बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक व सल्लिम अलैहि। Dear colleague, I am Dr. Sultan Ayub, working as radiologist. This female patient referred by the gynecologist for anomaly scan. So here we can appreciate that there is mild increase in the liquor. So when the liquor is mildly increased and the gestational age also first to second trimester, we should be conscious about this. So I'm scanning the abdomen of the. Here we can appreciate here this is the thorax and this is the fetal heart, which is significantly displaced toward the extreme left side, and the cardiac axis is also changed. So this is one finding we have seen, that the fetal heart is displaced toward the extreme left side. So let's see this one. You can appreciate this is the liver, and this is going all the way towards the thoracic region. So it has crosses the diaphragm on the right side, and it has reached or herniated at the right thorax region, so is causing displacement. We see it on the transverse section. Here we can appreciate the fetus is breech. Here we can appreciate this is the heart, fetal heart, and this is the herniated liver. And when we move toward the abdomen, here we can appreciate look at one. This is the anechoic structures on the left side, that is dilated stomach, and another dilated anechoic structure is on the right side, which is the dilated proximal duodenum. So this is another finding. Let's see. Look here. This proximal duodenum is communicating. This we can appreciate this proximal duodenum is communicating with the stomach. Stomach is present on the left side, while the proximal duodenum is present on the right side, and it is then crossing the midline. Here we can appreciate it is crossing the midline and then communicate with the dilated stomach. And these are the bowel loops which are collapsed in the lower abdomen. So two findings we have seen. One is the herniation of the liver on the right side of the from the right side due to the defect at right hemidiaphragm, and other is the dilated stomach and proximal duodenum that are communicating with each other. So this is called the classical double bubble sign, and the most common pathology or most common likely diagnosis is the duodenal atresia. What happened in the duodenal atresia? Usually around the 8-10 weeks, there is epithelial proliferation of duodenum. Then there is a temporary occlusion. When this happens, the proliferation is also temporary. When this happens, then again there is a recanalization of the duodenum, and then duodenum becomes patent. But after the 10 weeks, or around the 8 to 10 weeks, there is failure of recanalization. When there is a failure of recanalization, there is complete obstruction to the outflow of the fluid from the proximal duodenum to the rest of the bowel. So this is the pathophysiology of the duodenal atresia. Other differential may be duodenal stenosis. But once in the duodenal stenosis, there is to and fro motion of the intraluminal contents, fluid. Here I have not seen, and also somewhat fluid is seen, or the gas is seen in the distal loops, small bowel loops. Here the loops are collapsed. So we can exclude the duodenal stenosis. Another is the endopancreas, which externally pancreatic tissue externally compress the proximal duodenum, but there is also the partial obstruction, so we can appreciate the fluid or the gas in the distal loops. And other differential may be the malrotation, but in the malrotation we can appreciate the whirling of the vessels, mesenteric vessels at this upper abdomen, which is also very difficult to see, but we can see it. So I have not found such findings in this also. So in my opinion, this is the classical case of duodenal atresia with double bubble sign, and also the another anomaly is the right-sided congenital diaphragmatic hernia, through which the liver has been herniated into the thorax, displacing the fetal heart toward the right. This was the all about this case. Again, I can show you. Look here. This is a herniated liver going toward the thorax. This is the stomach on the left side, and this is the duodenum, proximal duodenum on the right side, and this is communicating with the stomach across the midline. Liver, liver, fetal heart, collapsed bowel loops, urinary bladder. Double bubble communicating. So this was all about the case. Thank you very much.